is Wendy Jones, and you're listening to The Patriot, FM 101.5, AM 1400. Welcome back to our program. We're here today with Dr. Kallabat, and man, it's been fascinating. I love what you do, and I just want to encourage our listeners, if you have knee pain, shoulder pain, hip pain, whatever, there could be a referred pain that's happening from the knee, and I can only imagine how debilitating it would be to not be able to walk.
Absolutely.
And there's so many seniors I talk to every day that are in pain, really. And I feel like this is just an awesome alternative.
Thank you.
Especially the stem cell, like you were talking about, one time. You go in one time.
Absolutely.
And would you say that 80-90% of the people, like, it works and they feel the difference right after that one time?
Oh, absolutely. I think that any of the therapies that we offer, the stem cell will give you the most relief and the most long-term relief. As we mentioned earlier, it's the one that provides the most direct regenerative type therapy. We've had patients, we did one about a year ago as a gentleman in his mid-30s for a knee, and he was at the verge of needing a knee replacement according to his doctors, and he came in and we offered him the stem cell therapy, and we did the stem cells, and within 2 weeks we called him and said, how are you feeling? He said, this is the first time I've slept through the night in a long time, just from his knee pain. Absolutely. So these are just one of many stories of knee relief that people will get. And again, because you're starting to regenerate tissue. Mm-hmm. And I think that's one of the most important things that we gain out of stem cells is we're not just putting a steroid in where the steroid is providing
for
temporary
30 days. Right.
And I think that's what a lot of elderly patients have been offered in the past is a steroid, and the benefit that they think that they see is that there's a very immediate relief. They get relief within 2 days, but the problem with that is that you're really just putting a Band-Aid on something and really not getting to the root source of the problem. And really, in most of those cases, in elderly patients who kind of end up doing these steroid injections, after steroid injections, they find that their knee is actually degenerating more, and you're actually creating more advanced knee arthritis because steroids in and of themselves cause degeneration. We had another lady who had come in a few weeks back and was getting steroid injections in her knee, and we offered her the stem cells, and again, she's a very similar story. We said, how are you doing? This was a few weeks later, and she said, remarkably well. I feel a lot better at this point, and I'm so glad I didn't continue doing steroid injections. So I think this is one of the things that people will do is the steroids because they're quick, easy in the doctor's office, and most doctors who are going to do steroids, I've done them myself in my own office. We don't do them under imaging because it's not one that really requires imaging because you're still getting into the joint space, but you're putting a larger volume in there, and depending on how you get into the knee joint space, some of it might get in the space, some of it might not, but you're still going to get some relief with steroids as opposed to gels, PRP, and stem cells. Those are very key to get into the joint space. Okay. Because that's going to create more regenerative therapy as opposed to anti-inflammatory therapy, which is what you're gaining out of steroids. Right. And I think that when you look at the differences between what we're offering and what people may have tried in the past is a very remarkable difference.
So let me ask you this, the gentleman you talked about that was 30 years old, is he good now for like 5 years, or like how frequently would he have to come back and do this
Well,
again?
hopefully he doesn't need to repeat it again.
Ever again?
Well, that's always an individual thing because it just depends on what he does to himself. Meaning, does he...
Oh, he could be a crazy fool and go...
Well,
yeah,
you can do a lot more activities.
If he's jumping out of a plane and landing on his knees.
If you're doing activities that are going to damage your joint, sure, it might not last as long. Or if your job is something that requires you to use your knees a lot, that can obviously create more problems later on, and then you can do another stem cell if you wanted to do that. So there's really no limit on how many stem cell treatments you can receive.
Okay.
And that's, I think, one of the biggest questions is even with the hyaluronic acids that we offer, even with PRPs, you can do them as frequently as you want because they're not creating degenerative damage to your knee joints. Whereas the biggest thing I've told patients years ago when I started doing, in the beginning, steroid injections, I told patients, listen, you don't want to do more than 1 to 2 of these per year, if that. That's actually too much. And if you're doing that many, if you're needing more than 1 or 2.
Okay, this is important because yes. I don't know that all doctors are telling patients that. This is the first time I've ever heard that.
Yeah, this is a very important thing. And if you look at the literature, and as again I said earlier, is we're a very information-driven society, and if you look at the literature on steroid injections in the knees, or any joint for that matter, if you're continuously using them, you're actually creating degenerative disease, you're creating more dry joints, and eventually those patients will get worse over time. The only benefit that you might get out of somebody doing a steroid injection is the person that really needs relief immediately because they're in such dire distress that you're going to give them a one-time injection followed by one of the regenerative therapies that we offer. But if you're strictly going just to do steroids, it's probably, not probably, it is the wrong way to go. You want to go more, and in our society today, we're not really looking at putting band-aids in medicine, we're really looking at what's the better option, what's more of a regenerative option. People are looking at all the regenerative therapies for all types of things in health, and unfortunately for patients, knees become a big problem. So we're here to help out and look at what's the best way to regenerate tissue, and really it's with the therapies that we have here to offer it.
Doctor, share your information with our listeners, your phone number, where you're located. I think it's important that y'all know this.
Sure. Our phone number is 248-952-9190. We're located in Beverly Hills, Michigan. Our address is 31333 Southfield Road. We're in Beverly Hills, and we're right on Southfield Road, just north of the Taco Bell.
Taco Bell.
Yes. You can pick up a gordito and stop in right after. We'll be there for you.
North of the Taco Bell. I just
Correct.
had Taco Bell for lunch, and I know everyone's going, what? You have Taco Bell? Not often, just for the record.
So it's right around 13 and a half miles. It's almost between 13 and 14 miles, so you can't miss it. It's almost sharing the parking lot. So if you accidentally enter Taco Bell, pick me one up too.
Oh my gosh, that's great. Well, we have talked about a lot of information today. What would, if some listeners are just tuning in for the first time, what would be your most important takeaways from today's program that you want them to know?
The most important thing would be don't wait too long before you intervene for knee discomforts, because the longer you wait, you're going to create more joint discomforts, you're going to create more debility, you're going to create more distress on your own self. And there are easy ways to fix that, and I think a lot of people, when they don't know the right avenues to go for treatment, they stop looking. They don't go and they don't seek attention, and they'll let things continue on and on for months and months on end. But we're here to offer you a very, very good alternative that's very easy and simple. And I think the main key thing is don't wait too long, because if your one knee is hurting, we don't want to make the other knee uncomfortable and cause damage to the other joint.
So my takeaway just from listening to you, listeners, is really to know that you don't need a physician to write a script for you in order to make the call to your office.
Correct.
Because I really feel like a lot of people think they have to go to their primary care, they have to get a script and get, just like with a surgery, you know, you go through all this approval process, like, are you a candidate, can you do it, can you not do it? There's nothing, you just call the number.
Correct.
And then you come in and do the consultation, and then you guys can do it.
Absolutely. We'll determine whether or not you're a good candidate for it, and as I mentioned earlier, we'll make sure that you're a good candidate. If not, we'll be very upfront and honest with you and tell you it's not going to be the right thing for you. And if it is, we're going to advise you that this is the best direction for you, because we want you to get better. We want to have more and more stories as time goes on with New Life. Success stories.
Exactly.
With New Life Medical.
So recap the different things that you offer. I know the hyaluronic acid, you
Correct.
call the gels.
Gels, yes. Hyaluronic acid is one of the therapies that we offer, which, as we mentioned earlier, is covered by Medicare and most major health insurances. PRP, which is platelet-rich plasma, which is the one that is drawing blood from your own body and re-injecting the plasma into the joint. And then the most advanced regenerative medicine is the stem cells, which we're using exosomes, which are basically a product extracted from a stem cell, and which is more of a newer technology for cell-to-cell communication in regenerative therapy.
Excellent. Well, I'm excited to have you here today.
Thank you.
I appreciate
Thank you for
your
having me here.
knowledge, I appreciate your wisdom, and I love that you get to the root cause of the problem and have a solution. So listeners, instead of surgery, why not try them first? One more time on your phone number.
Yes, 248-952-9190. So again, 248-952-9190, and right on Southfield Road in Beverly Hills, right north of Taco Bell.
I love it. I love
Yes.
it. And I wanted to remind our listeners, coming up on November 19th at the OPC right here in Rochester, Savvy Seniors is having a panel discussion. We've got some experts in healthcare that are going to be there. Next Steps for Seniors will be there. And basically talking with the families, and they're able to, it's open forum, you're able to ask a ton of questions. So I just want to encourage the listeners. It is a free event. And again, it's from 6 to 8 p.m. on November 19th. It is on my Facebook page, Next Steps number 4 Seniors, or you can call the OPC to get information. And share your Facebook page again.
Facebook is New Life Medical.
NU, not
NU,
NEW.
yeah, exactly. NULIFE Medical.
We got it. We got it. So definitely call them. Make your appointment today. Do your consultation. It is worth it.
Thank you.
It is worth it. I appreciate that there's an option out there. And stay away from the steroids.
Yes.
But yes, you can go to Taco Bell too.
Absolutely.
I just had to throw that punchline in.
No.
Yes, I did go to Taco Bell today. I know everyone's like, really? So thank you, doctor.
Thank
really.
you. Thank you for having me here.
We appreciate what you do and just the innovativeness of what you've started.
Thank you. Thank you.
We all do need it. Again, you're listening to The Patriot, FM 101.5, AM 1400, each and every week, Saturdays at 11, Sundays at 10.